Welcome back into Wave 3 Listens Live. I'm Michael Vanover, joined by Leesa Innenbach from Body Shapes Medical. We're taking your calls at 571-5263. We're talking everything from weight loss to hormones. We're going to talk about Exilus a little bit later on, but we've got a full bank of phone calls, and we're going to jump to those right now. We're going to start off by talking to Lauren in Hikes Point. Lauren has a nutrition question for Leesa. Lauren, welcome into the show. How are you?
Fine, I'm doing great. My husband and I are in our 40s, and we have 4 teenagers. Say we go through this program and you'll help us lose the weight. Is there some way or someone, a nutritionist or whatever, that can help us implement what we've learned through that so that when we come home, and because teenagers are ravenous and they eat and we buy and we buy and we buy.
I understand, Lauren. I've got 2 kiddos at home, not all teenagers just yet, but absolutely. What we would do, and I have found this a lot with couples especially that come in, they say, you know, once the parents start eating better, the teenagers start eating better. I'm not sure if your question was that they had some weight issues as well. I have a teenager that had some weight issues. He's recently lost 30 pounds. You know, you want to set good examples for them. If you guys need to lose some weight, get in there. You're going to start eating better because we're going to teach you how to eat. Now, you may need to eat a little bit differently than your husband does, such as me and my husband, but you can definitely work around that. We do nutritional counseling. Again, if you decide to go with the HCG program, which is the Accelerated Weight Loss Program, it's going to be a very, very specific diet for the first 28, 40, or 60 days, and then the next 3 weeks is going to be very calculated as well. And then after that, we nutritionally counsel you with a computer system set up to where you log every food in, and we see how your body reacts to every food. I'm never going to take any food away from you and say, oh, Lauren, you can never have this food or you can never have that food because you'll never be able to keep the weight off. That's not true. We don't use box meals. We don't do any of that. We just guide you on your best way to eat for your body to make sure that you're keeping the weight off. And hopefully that'll follow along with your kids as well.
Thank you so much for the call. We really appreciate it. We are going to now jump to the next phone call. We've got Sue calling it from Clifton. Sue, welcome into the show. Are you with us?
Hello.
Hi, how are you?
I'm just fine, actually. My question today is, I don't need to lose any weight. I'm pretty fit, but I'm 43 years old, and I'm tired all the time. I get fatigued during the day that I just want to just sleep during the day, and I just don't have any energy anymore. And I eat healthy, and I do have night sweats, and I do get a loss of appetite.
Sue, it sounds like you're a perfect hormone replacement therapy candidate. What you would need to do is come into the office, we take a full health history, and then we would definitely want to get some labs on you. Now, we can dose you based on just your symptoms, but we want to get a baseline. We want to see where you are. It's important for our patients to know these symptoms probably didn't happen overnight, so we probably can't quote-unquote cure them overnight. It might take 3 months. We might dose you perfectly at first. It might take 6 months. We like to keep our patients in the program for at least a year. And again, we do have a team of medical professionals that will look at everything once we draw your labs. We have doctors. We have registered nurses. We have a compound pharmacist. Everyone's going to look at your labs and say, okay, here's Sue's labs. Here's what she's deficient in. Here's what we need to optimize. Let's get that taken care of and get everything back where it needs to be to get you feeling a lot better.
Thank you so much for the call, Sue. We appreciate it. We're now going to go to Dorothy in Louisville. Dorothy, are you with us? Welcome into the show.
Hello?
Hi, what's your question for Leesa?
Hi. Well, my question is body fat in women, myself in particular, especially around my middle. And I just wonder how, is there an easy, simple way to get rid of it? Is some kind of a diet, or, you know, what can I do?
Dorothy, you would probably be a candidate for either HCG or Exilus, actually. If you've just got a little bit of belly fat and it's just a couple extra inches that, hey, I'm at my perfect weight, but it just seems like every time that I lose weight, I just always have this belly. Exilus is a very good treatment. It's radio frequency, and what it does, for lack of a better word, is melt the fat. What your body takes over and kind of gets rid of it through your lymphatic system. So it could be that you just need to, some Exilus treatments to get rid of that. Now, if that's not the case and maybe you do want to actually lose some weight, that's fine. You could start with the HCG program, because what HCG does is actually gets rid of the abnormal fat. So you're going to lose weight exactly where you need to lose weight and retain the muscle that you need to retain. The best thing I can encourage you to do is come in. The consultations are absolutely free. Get on our website, check out some of our videos, make that phone call today, and come in for a consult, sit down with a registered nurse, and go over all of our programs and just see which one best fits you.
Thank you so much for the phone call. We appreciate it. We're now going to jump to Christina, who's calling from New Albany. Christina, welcome into the show.
Hello, how are you?
I'm doing well. How about yourself?
I'm doing good. I have a question about hormones and changes in your skin, like in the face area. When I hit about 25, I realized that I started getting almost like a brownish tint in certain spots, almost like it would look like liver spots or age spots. And it gets really bad when I get out in the sun. Do you know, like, any type of treatment for this type of problem? Almost above, like, the upper lip area, it seems to get darker.
That's probably hormone related as well. Again, we'd have to get you in, look at your labs, and see what's going on. We do have several other treatments in the office that maybe we could help you with. But again, it sounds like it's probably hormonal. You said at about age 25. Usually changes like that don't start to happen until about age 30. But again, everybody's a little bit different. Every patient, no patient is the same. Let's get you in there. Again, the consults are absolutely free. Have somebody take a look at you and get a set of labs drawn and see what's going on with you.
All right, well, thank you so much for the call, Christina. We appreciate it. We have a lot more calls to get to and a lot more to get to with Leesa Innenbach. We'll get to that when we come back, but don't forget, give us a call, 571-5263. If you give us a call with a question for Leesa, you'll be put in a drawing for 2 tickets to Holiday World, so make sure you give us a call right now. Or you can always call them at one of their offices at 425-0500. We'll be right back. More with Leesa Innenbach when we come back on Wave 3 Listens Live.